Hi there. So I am here completing the week 3 assignment. One of the choices was to interview a healthcare professional about their use and experience with antibiotics. For this assignment, I spoke to my dad, who is Robert B. Rosenberg, MD, PhD. He's an attending physician at the pediatric ICU at Phoenix Children's Hospital. So I started by asking him how often he used antibiotics at work, and he chuckled and said every day. Um, and then asked about if there were different types of antibiotics that he used, or if a few were more common, and how did they decide what antibiotics to use for treatment. He explained that there are a variety of classes of antibiotics, and the strategy is to start with a broad antibiotic treatment and to narrow as you get more information as to what kind of bacteria is present, and augment the treatment based on the patient's progress. I asked him if he thought antibiotics were overprescribed, and he said in general, yeah, they are overprescribed by providers. He works with kids, so I asked him specifically about pediatric patients, and he said that he thinks it's especially common with kids, mostly because sometimes parents insist on antibiotics when their child is sick. They want to have some sort of pill or fix when their child is ill. And then we kind of talked a little bit about what's wrong with overprescribing. And he said, and I quote, the bugs are smart. And what he meant by this is that they adapt and they mutate and grow according with what kind of treatments they're exposed to. So when people are overexposed to antibiotics, the bacteria that they have in them and on them are able to kind of learn from that experience. And that's how we get all of these superbugs that have been so common lately. He also explained that when a child is prescribed antibiotics when they have a virus, it not only eliminates microflora, but it also changes the microflora in that individual for future experiences, which also causes a lot of really resistant strains of bacteria. And that is all I have for you. Thanks.